Hi, I'm Congressman Randy Hultgren. As promised, today I introduced a bill that offers states the freedom and flexibility to pursue health insurance alternatives and innovations that could better serve the people who live there. The State Healthcare Options Act is the first step out of the Affordable Care Act, commonly known as Obamacare. The ACA was marketed to the American people as a solution to our nation's healthcare access and affordability problems. President Obama promised the American people their premiums would not go up. The results couldn't be further from the truth. Premiums for people in my home state of Illinois are expected to increase by as much as 30% next year, and health insurance options have dried up, with one insurer now owning more than 90% of the market. Without real competition in my state, citizens will continue to pay through the nose. The one-size-fits-all ACA and its extraordinarily high deductibles and premiums is now robbing families of hard-earned savings for their children's education and their own retirement. This can't stand. Last summer, I organized a community leadership forum on healthcare in the 14th Congressional District, where I listened to insurers, employers, hospitals, doctors, patients, and caregivers who told me about the challenges they're facing. The ACA is failing many of the people I represent. They're being offered fewer choices at a higher cost. The bottom line is that my constituents need the ACA changed. Here's where my bill offers a solution. The State Healthcare Options Act would grant states an immediate parachute off the daunting premium increases being floated by insurers for the next year. My bill would use and reform an existing ACA tool, innovation waivers, to provide states a way out of the ACA, similar to No Child Left Behind education waivers many states have taken advantage of. By revamping the ACA's innovation waivers and the application process, my bill would give states real access to these important tools to opt out of the law's most onerous provisions that are crippling innovation. States would be able to waive either or both the ACA's restrictive health benefits regulations and the law's exchange provisions that limit consumers' options to buy health plans. My bill does maintain the provisions for pre-existing conditions and eligibility for parents to keep their kids on their plans until age 26. My bill would also reform the ACA's flawed insurance subsidies, allow state health insurance markets to offer a more robust menu of options at a lower cost, and increase health plan transparency so we all know exactly what we're getting and being charged for. The first 5 years of the ACA have offered us more than enough evidence that it's time for something different. My State Healthcare Options Act would give states a real opportunity to more effectively tackle their unique healthcare problems by using waivers to chart their courses away from the ACA's one-size-fits-all approach. Our founders believed our states are laboratories of democracy, which can independently produce and test their own approaches to challenges they face. Many states have led the way for successful approaches to countless national problems. Healthcare should be no different.